Hello. Hello, my hospice family. Hello. Welcome. Welcome, my hospice family. Welcome. How are we doing today? Welcome back to Duns Hospice. Okay. My name is Miss Dawn, and I shall be your hostess. All right, guys. Thank you so much for being here today. Thank you, thank you. I miss you guys so much. All right, and I pray that this video will find you well. I know that in the previous videos I mentioned to you guys that, to you, my hospice family, that I was going to put in a long short video, like not a long short, a long video about the criterias. Okay, so this is what I'm doing right now. We are continuing our conversation regarding the criterias of hospice. Okay, so come on in. The criterias of hospice care. Okay, I hope that my lighting is good. I hope that, you know, everything is well. I don't know if I should put it further or back, but let's leave it like that. I think we should be good, right? All right. Of course, my beautiful hospice family, I'm going to ask that we continue our support the channel. Okay, support the channel. I'm on DunsHospice, okay, on TikTok and also on Instagram. All right, my beautiful people, I want us to have a great conversation tonight about end of life care. Okay, absolutely, about end of life care. I can't wait. If you have any questions about heart failure, please let me know. Let me know. So we are talking about heart failure, hospice eligibility, okay? Eligibility regarding hospice care and heart failure, okay? Can you hear me, my beautiful people? Can you hear me? Let me know if you could hear me. Can you guys hear me? Let me know. Just write yes if you could hear me. How's my sound? Is my sound okay? Let me know if my sound is fine. Right? Come on in, my beautiful hospice family. Come on in. You guys are awesome. Absolutely awesome. Thank you for coming in. As you come in, please, as always, I'm going to ask that please say your name and let me know where you're from. Welcome to DunsHospice, everybody. Yay, my people are coming in. Hello, my beautiful people. Welcome to DunsHospice. My name is Nurse Dawn. For those of you who are new to the channel, my name is Nurse Dawn. Welcome. Okay, I am so thankful. I'm so happy and glad that you are here. And let me know if you or somebody you know, if you or a loved one if you or a loved one has a diagnosis of heart failure. Let me know, my hospice family. Okay, here at Duns Hospice, we talk about end of life care. You see, we talk about how to help our family members who are at end of life. So let me know if you or a loved one of yours currently have problems with their heart. Like, have they had a heart attack? Do you know somebody who has had a heart attack? You know, have you yourself had a heart attack? Some of us, we are born with a heart defect, you see, and many of us, because of certain lifestyle, you know, in the past, it affects our heart. So let's talk about heart failure, okay? Because I want to talk about three main criterias, okay? When it comes to heart failure, I want to talk about three main criterias in this video. to know if your loved ones may qualify for hospice, you see, because many times as a hospice nurse since 2012, families will call the office where I work and say, dad is having difficulty breathing. Should I enroll dad under hospice care? When do you know it's time to choose comfort versus treatment? Hello, Sade. Hi, my friend. Come on in. Let's talk. We are talking about heart failure. My name is Miss Dawn. My name is Nurse Dawn. I'm a hospice nurse. I'm a registered nurse, okay? We are talking about heart failure at end of life, okay? Please be sure to subscribe, okay? And give me a like, guys, okay? Subscribe and give me a like. This video is going to be very informative. Please share it with your loved ones, share it with a friend that you think might qualify. Do you know anybody with a heart failure, with a heart attack? Okay, let me know. But yeah, so as a nurse, I hear families, they will call into the office and say, does my loved one qualify to be under hospice? What exactly do I need to look out for? When do I know that it's time to focus on comfort versus to keep on going to the hospital? Because as you and I well know, when we go to the hospital, we come back with another illness. We go in there with something, especially our elderly patients. There's a lot of germs at the hospital. Our elderly patients, get more confused, you see. So if we could keep mom and dad at home and treat mom and dad at home, that is so much better. That's often the best thing to do. So yeah, so I'm going to give us 3 criterias, okay? My hospice family, please take down your pen. We are going to talk about 3 criterias that we can follow to know when it's time to call hospice, okay? And of course, please share with me. I love it, okay? When you share with me, when you talk, when you're engaged, it helps me to share more stories, it's just really awesome when we can go back and forth at engagement. Okay, so the first criteria that we look for, so when you call the office and you say, or when the doctor called the hospice office, okay, and say, I would like Mrs. Smith to be looked at. I would like Mrs. Smith to be evaluated. So what happens is that the admission nurse will go out, and so I would go out as a nurse, and I would go out and assess your family, you see. And those 3 things are usually what we are looking for when it comes to end of life care, hospice care. The first thing is, we ask you, is your mom being optimally treated? Okay, is she being optimally treated? And I'm going to write that in the chat, okay? All right, so I'm actually going to write the 3 things. Okay, my beautiful hospice family. So optimally treated, okay? All right. So that is one of them. Is your loved ones, are they being optimally treated? Okay? I hope I spelled it right. So optimally treated usually means that, are they taking all of the medications that the doctor recommends? You see, are your loved ones are they on all of the medications that the doctors recommend? And despite taking all of the medications, are they still not able to function properly? Are their heart still not able to pump blood properly? You see, and optimally treated means that all of the medications and procedures and operations that the patient can tolerate, okay, that your loved ones can tolerate, you see. So there are so many different medications out there for heart failure, you see. But you yourself, according to your body, according to your organs, because some people with heart failure, they also have kidney disease. You see, they also have hypertension. They also have diabetes. Okay? So when you hear the nurse say optimally treated, or when you hear the doctor say optimally treated, it's specifically to you and your body. What can you tolerate? Okay? Have you done procedures? Have you done, operations, and still your body, your heart is not able to pump blood effectively? Are you taking, Lasix? Are you on lisinopril? Are you on metoprolol? You see, are you on digoxin? Have you had procedures done and still are you on oxygen? Okay, so when I say optimally treated, that's what I'm referring to. I'm referring to all of these different kinds of medications and operations and testings that you might have had, and still your heart is not functioning well. Okay, so that's the number one. I only have 3 that I want to go over, okay, my beautiful hospice family. And please, like I said, ask me if you have any questions, okay? If you have any questions, please let me know. And be sure to subscribe, okay? Subscribe and give me a like. I would love, love, love to hear your input, okay? So that's number 1. Number 2 is the New York Heart Association Class 4. All right? We follow the Medicare guide, and the Medicare guide goes along with the New York Heart Association Class 4. Let me know, guys. Let me know who among you watching right now have heard of the New York Heart Association Class 4. I'm going to also write that down in the comments section, okay? And let me know. For those of you who have had experience with hospice, for those of you who are in the medical field, let me know if you have seen this. Okay? All right. So this is another criteria that hospice will use, that the nurse will use, okay? New York Heart Association Class 4. And what I mean by that is, so let me briefly go over number 1, 2, 3, okay? Like, let me briefly explain exactly, what they are, like, starting at number 1. So Class 1 means that you and I, the person, can perform regular activities effortless with no problems, okay? So that's Class 1. Class 1 means that ordinary physical activities does not impact the person's life, okay? So that's Class 1. All right. Class 2 means that there's a mild limitations on physical activity. You see, so maybe when the person is walking, they have to stop to catch their breath. You see, nothing major. Or maybe the person might say, I'm feeling more fatigued than usual. All right, so that's Class 2. All right. Class 3 is when your loved ones is comfortable at rest, but when they start doing activity, it becomes difficult for them to breathe. All right, so that is Class 3. Class 3 is your loved ones is comfortable at rest, but when it comes time to do activities, you see, then they get really winded. And Class 4, as I wrote down in the description in the comment section, Class 4, my beautiful people, that is when the person becomes extremely shortness of breath, extremely fatigued, just by sitting down. You see? You see how I'm just sitting down like this? So they would get shortness of breath by doing nothing. And I have seen where the person is just laying down watching TV and they're still, you see, they're still having difficulty breathing. And so that is class 4. So that's what we look at. We look at New York Heart Association class 4. And of course, my beautiful people, let me know. Let me know if you have any questions. Let me know if you have any comments. All right. Please, please, please share. Share your thoughts. Okay. Share your thoughts with me. Help me to spread the word. All right. Because oftentimes I want us as family members, as caregivers, to know that you are not alone. And when you see your loved ones cannot move around, cannot do the activities that they used to do, of course it's going to hurt you. Of course it's going to bother you. You see? And sometimes we don't know what to do. And I'm here to let you know help is around. Like, there is help around. You don't have to feel like you are all alone. There's definitely help. Okay, we are here to help you. Okay, so that's the second criteria, my beautiful people. And let me know, like I said, if you have any questions, you could DM me on Instagram. You could DM me on TikTok. Okay. And of course, feel free to check my YouTube channel. I mean, not YouTube channel, sorry. My internet, my website. All right. Check out my website, DunsLove or DunsBeautifulPeople.com. All right. Those are my 2 channels. These are ways that you could get in touch with me. Okay. All right. So last but not least, the third criteria, okay, that we look out for would be ejection fraction. Okay. And I'm going to write it down also, ejection fraction, just so that you can have it in mind. You see, so that you can have it in mind if you find yourself needing to go to the hospital, if you find yourself, in a situation where you are caring for somebody who with heart failure. These are the questions. You could bring these topics, okay, to your doctor office and start the conversation, because oftentimes we don't know what to say when we go to doctor's office. Okay, we don't know what to say. So these are ways you could start the conversation. You could ask the doctor, hey, what's my husband's ejection fraction? What's my wife's ejection fraction? Okay, also known as EF. And I'm gonna put 20% or less, but there's also 20% or less. Okay, so if your ejection fraction, meaning how well your heart is pumping, is 20% or less, that's another criteria that would let the hospice staff know, and that would let the doctor know that maybe it's time to start talking about hospice care. You see, because an ejection fraction of 20% or less, it really means that the heart is not pumping well at all. Okay, now I want to make it clear that just because an ejection fraction is 20%, that doesn't automatically qualify somebody for hospice. The doctor has to determine that. And also at the same time, the opposite is true. Say the ejection fraction is 40%. You don't have to wait till it goes down to 20 to call hospice, because if the other 2 criteria that I listed, are there, and the person quality of life has drastically, you know, gone down, that's another reason why they may qualify to be under hospice care. Because hospice, we look at the whole picture. You see, we don't just look at one thing, we look at the whole picture. Okay, my hospice family. So that's what I wanted to come out here and talk to us about. Let me know if you have any questions. Let me know if you have any questions. All right, and I want you to know that, and I'm going to probably come back tomorrow and make another video about what can hospice do. Okay, what can hospice do? um what can hospice do to help? Like, how does hospice care play? Like, what role does hospice care play in this? Like, how can you benefit from signing your loved ones under hospice care with a diagnosis of heart failure? You see, so I'll probably come back tomorrow and talk more about that, but this is what I wanted to talk about tonight. Okay, all right. So thank you so much for being here with me. I appreciate you so much. Enjoy the rest of your evening or morning, wherever you are in the world. Be sure to follow, give me a like, subscribe. Okay, I'll see you in the next video. Take care of yourself and each other. All right.